Imagine that you are expecting your first baby. Your husband and the rest of your family are preparing for the baby's arrival. However, there is one thing that you need to remember when you are pregnant: gestational diabetes. Welcome to Fit Fusion TV channel. Today, we will discuss an unsung illness known as gestational diabetes and how to prevent and treat it. But wait, why do I have to worry about gestational diabetes if diabetes doesn't run in my family? That's what we're going to discuss today.
I'm willing to discuss terms.
The International Diabetes Federation, or the IDF, reported back in 2017 that 14% of pregnancies globally, or an estimated 18.4 million pregnancies worldwide, were affected by gestational diabetes. By the year 2019, 1 in 6 births involved women with gestational diabetes. Other than that, the Centers for Disease Control and Prevention, the CDC, reported that 2% to 10% of all pregnant women in the United States are diagnosed with gestational diabetes every year.
Hell no.
What was surprising here is that the rate of women who were diagnosed with gestational diabetes increased by 30% from 2016 to 2020, and that means in every 100 women, there are 7 of those who are clinically diagnosed with gestational diabetes. So how are you going to prevent it? Well, you'll find out as we dive into this video. First, what is gestational diabetes?
Who knows?
Gestational diabetes is a type of diabetes mellitus, wherein your hormones can't keep up with making insulin during pregnancy. Mind you that your body is working too hard to manage your baby, yet there are cases wherein your pancreas, an organ that releases insulin, can't keep up to the point that your body's blood sugar levels will spike up. Sugar or glucose plays a crucial role in our bodies since it is energy. To convert glucose into energy, you need insulin. We all naturally have insulin in our bodies, yet there are chances that our pancreas can't keep up with the demand of our placenta. This is when your blood sugar levels will rise and lead you to have gestational diabetes. You might feel the following signs and symptoms of gestational diabetes during pregnancy, such as frequent urination and increased thirst and hunger. Technically, it is difficult to know if you have gestational diabetes or not, and that is why it is essential to follow your checkup schedules with your doctor, so that you'll be screened before your delivery. So, how will you be screened for gestational diabetes during pregnancy? Well, your doctor will run one or either of these 2 tests to diagnose if you have gestational diabetes, and these are glucose screening test, oral glucose tolerance test. In the glucose screening test, a health professional draws your blood an hour after drinking a glucose beverage. Remember that you don't need to fast for this test. The American Diabetes Association provides a normal blood sugar range. 95 milligrams per deciliter is expected to be your blood sugar before you eat, while 120 to 140 milligrams per deciliter must be your blood sugar level after you eat. Anything above 140 milligrams per deciliter must be notified to your doctor so that you can run an oral glucose tolerance test. During the oral glucose tolerance test, you must have your fast for 8 hours, which means that you do not need to eat or drink anything, including water. Once you hit the 8-hour mark, a med tech will draw your blood and you'll drink a glucose beverage. Then, they will extract your blood every hour for 2 to 3 hours for your doctor to determine if you have gestational diabetes. If your doctor noticed that your blood sugar levels spiked at least 2 out of 3 of these blood extractions, that means that you have gestational diabetes. Now, the question that most moms ask is, if I am at risk of having diabetes, does that mean my baby is also at risk? Technically, yes, but in every illness there is a cause, and gestational diabetes develops when the body cannot produce enough insulin to manage increased blood sugar levels during pregnancy. Hormonal changes largely influence this condition. Essential hormones such as estrogen, cortisol, and human placental lactogen, HPL, support pregnancy and increase insulin resistance, particularly between the 20th and 24th weeks of gestation. This period is crucial because these hormones peak in concentration, heightening the risk of insulin resistance. The pancreas, responsible for insulin production, usually adapts to these hormonal changes by producing more insulin. However, if the pancreas cannot keep up with the increased demand caused by hormonal changes and insulin resistance, blood glucose levels rise, leading to gestational diabetes. This inability to produce sufficient insulin in the face of pregnancy-induced insulin resistance is what ultimately triggers the onset of gestational diabetes. Although there are only 2% to 10% chances of having gestational diabetes, these chances can significantly increase if you have any of these factors: obesity, being pregnant at the age above 25, having too much amniotic fluid, diabetes runs in your family, and giving birth to a giant baby before. It might be scary to realize that you might have gestational diabetes during pregnancy, but there are tons of ways to avoid gestational diabetes. Such as having regular exercise. Take note that you don't have to do heavy activities such as lifting weights. A short morning walk is more than enough to keep you in perfect shape despite being pregnant. A gestational diabetes diet includes eating meals with lean protein, fruits, vegetables, and whole grains. Now, if this is treatable and preventable, then how does gestational diabetes affect my baby? Well, having gestational diabetes can bring you the following potential risks. 1. Having a preterm birth. Do you still remember that one of the risks of gestational diabetes is having too much amniotic fluid, or polyhydramnios? Having too much amniotic fluid will burst your bag of water, and this will lead you to have a preterm birth. So, if your doctor diagnosed you with the gestational diabetes, you need to be very strict in monitoring your blood sugar levels to prevent preterm birth. 2. Macrosomia. We know that having a big baby looks cute, but remember that babies with macrosomia will have increased risks of obesity and type 2 diabetes later in their lives. 3. Neonatal hypoglycemia, or low blood sugar for babies. Your body might be releasing more insulin to manage your glucose levels. When you have gestational diabetes during pregnancy, yet your insulin can't pass through your placenta, only your glucose. Thus, if you have excess glucose, your baby's pancreas will start releasing insulin to manage the glucose you've passed onto your baby. This will cause them to have excess insulin in their bodies, leading them to have deficient blood sugar levels, or what is called hypoglycemia. A baby with deficient blood sugar levels will have breathing problems, so the pediatrician will administer dextrose intravenously to restore the baby's proper blood sugar level. Hypoglycemia, or low blood sugar levels in neonates, infants, and children should be considered a medical emergency that can cause seizures, permanent neurological injury, and, in rare cases, death. As we said earlier, glucose is your body's energy and the primary fuel for brain metabolism. Anything low can cause the symptoms we recently stated. Mind you, babies that are born from mothers with gestational diabetes need to be monitored postnatal, since the pediatrician needs to know if your baby's body has the right amount of blood sugar before they room in with you for the same reasons mentioned above. Before we continue managing gestational diabetes, we would appreciate it if you hit the like and subscribe button. That will help our channel grow and provide you with more content. Likewise, every illness has its cause, and so does its management. These are the following ways to manage gestational diabetes during pregnancy.
Okay.
1. A low-sugar diet. Technically, you can eat anything you want during pregnancy, but in moderation. Do you crave cheesecake? Eat only a slice. A soda, try the sugar-free one. You are what you eat, and even though you may crave many things during pregnancy, it is essential to eat moderately. However, the American Diabetes Association recommends a balanced diet that includes meals with carbohydrates, protein, and fiber. Nevertheless, you do not have to deprive yourself of eating. You must eat moderately. Anything too much can lead to health problems such as gestational diabetes. 2. Exercise and lifestyle. Most people think that exercise is strenuous. It is not. Exercise becomes challenging if you see it as a challenge. But if you see it as a lifestyle, your whole life will change. And no, we are not talking about hitting the gym and lifting weights when you're pregnant. A simple early morning walk with your partner is an excellent start to your day. You don't have to do a marathon. You must take it slowly and gently. The American Diabetes Association also notes that physical activities can lower blood sugar levels since they make your body very sensitive to insulin. As we said earlier, the lesser insulin resistance, the better, and this can lead your pancreas to catch up with the contra-insulin reactions of your hormones during pregnancy. Not only can exercising help you stay in shape despite being pregnant, but it can also help you manage your labor by doing Kegel exercises. These exercises can help you strengthen your pelvic muscles and help you deliver your baby without inducing too much pain. 3. Medical management. For those who have been diagnosed with the gestational diabetes during pregnancy, don't worry. Every illness has its treatment. One standard treatment in gestational diabetes is insulin therapy. Your doctor will provide a specific range of blood sugar levels to apply insulin subcutaneously, or give you a particular type of insulin you need to inject in a specific schedule until your postpartum follow-up. Overall, pregnancy and diabetes are something that we usually don't know about since most of us think that we can have diabetes either through genetics or through a sedentary lifestyle. But either way, you need to remember that prevention is the most excellent medicine. One way to prevent illnesses such as gestational diabetes is through living a healthy lifestyle. To have a healthy lifestyle, you need to have a plan. You know the saying, if you fail to plan, you've already planned to fail. Always remember that. This is why newlyweds who want to start a family need to have a plan for their finances and health and well-being during and after pregnancy. You don't have to be very strict about diet and exercise when pregnant. All you have to do is be disciplined about what you eat and do daily, even after you deliver your baby. We greatly appreciate you taking the time to watch this video to learn about gestational diabetes. And always remember, don't take this as medical advice. If you are experiencing signs and symptoms of gestational diabetes, never hesitate to consult with your doctor. Either way, Fit Fusion TV channel empowers everyone to live their life while being aware of different illnesses and complications of the human body. Thank you for watching and hitting the like, share, and subscribe buttons. This is Fit Fusion TV channel. Be aware and be well.